Hey everyone.
Hi, everyone. We're the physicians at Ageless Rejuvenation Center. I'm Dr. Deacon Casey.
I'm Dr. Carol Bowen Wells.
Well, we're here to talk to you today about urinary incontinence. Lots of women face this problem, and there is a solution. We offer that solution at Ageless Rejuvenation Center. Now, Dr. Bowen Wells, what is urinary incontinence?
Urinary incontinence, the bottom line is, remember when you cough, sneeze, laugh, and you're like, oops, I think I just wet my pants. And you always have to wear those miserable pads, even though you're past the time of having a menstrual period. That's urinary incontinence. Your pelvic floor has gone out of control and you cannot control your urine. We are here to fix that problem. How are we going to do that, Dr. Casey?
Well, at Aegis Rejuvenation Center, we've come up with a specific protocol to treat stress urinary incontinence. And that protocol is a combination of therapies that synergistically or combined together create a much better effect, much longer lasting effect. And we've come up with this acronym. It's called FITT. So it's female FITT, FITT. So the first part of it with the F, it means to give your vagina a facelift. Now, everyone would love that, to have your face reflecting what your vagina looks like. And the I, it stands for an increased libido and increased sex drive. So that's an added bonus in terms of what this protocol can do for you in treating
Wow.
stress urinary incontinence. I bet a lot of women would like
Are
that,
you
don't you
kidding?
think?
With Valentine's and Christmas coming up, girls,
I think
husbands,
I think it's a winner. We're
pay
both women.
attention.
That's right. We're both women, so we understand what this is and we understand how to treat women. Now let's finish the rest of it. Now the T is for tighten and tone. So that's what we're doing. The FITT female fit therapy only offered at Aegis Rejuvenation Center. Now, Dr. Bowen Wells, tell us a little bit more about stress urinary
So I'm,
incontinence.
I'm glad you asked because an additional T would be to treat this urinary incontinence, the additional T. So there's so many different ways. So one is just a simple to sit on a chair. Can you imagine coming in to sit on a chair and have over 10,000 Kegel be thrown in your pelvic floor? So not only are you going to treat this urinary incontinence, you're going to get a butt lift in addition to that. Can you imagine?
That sounds like
Dr.
a great
Casey,
bonus to
what
me.
about this O shot things that people
Oh.
talk about?
Oh my goodness, it is really truly the O shot. Now, this O shot was developed by Dr. Charles Runnels several years ago. We've been both trained in this
Trained,
procedure
yeah.
to do this procedure, and also we're women, so we get it. What this is, we pull your blood, we draw it, we spin it, and we inject it in those two specific areas that will help to enhance your sexual intercourse, your sexual pleasure, helps to increase your lubrication in there, improve your vaginal tissue that's there. It's a very safe and effective procedure that we perform in our office.
In addition to that, we're going to use this fancy laser where we just place it into the vaginal canal, and that baby is going to tighten and constrict, and oh my Lord Jesus.
Now, who wouldn't want something tight? I think all the men out there would love that. So, what we've thought about, we've put all of these little parts and pieces together to kind of give you this wonderful effect. Female fit. We
Yes.
understand you. And, we're not leaving the men out because the statistics also show that 14% of males also have urinary incontinence. And some of these treatments can also help you to improve your symptoms.
I'm so glad you actually mentioned the statistics because if you imagine there are over 200 million people worldwide that suffer from this problem. In this country, there are over 25 million who have this problem. 17% of women between ages of 18 and 44 actually have this problem. These are young, healthy people, and we'd like to help you get rid of these pads and change your lives.
Exactly. Those are incredible statistics. If you think about it, lots of women don't even talk about it. You're just running, you run all the time, you dribble. You're not a basketball player. Turn off that faucet. We
Yes.
want you to remove those pads, ditch those pads. So you don't have to take Myrbetriq or any other medications for this. We're actually helping to treat the root cause of urinary incontinence, which is a weak pelvic floor. So everything that we've included in this package and in this protocol will treat that area. So think about it. Any muscle that you work out, it's going to do the job. It's going to bulk up, and it's going to help you to improve all of your symptoms. We mean what we say. You will get improvement in this procedure after you've come to our office. So you can reach us at 904-990-8484.
Come see us at
Ageless.